The primary dorsiflexor of the ankle is the tibialis anterior, which originates along the proximal lateral surface of the tibia and interosseous membrane and inserts on the plantar aspect of the medial cuneiform and base of first metatarsal. The action of the tibialis anterior is dorsiflexion and inversion. Also, the extensor digitorum longus, extensor hallucis longus, and peroneus tertius assist in dorsiflexion due to their lines of pull running anteriorly to the axis of rotation. The ankle dorsiflexors work eccentrically in the early stance phase of gait to control plantar flexion, and concentrically during the swing phase of gait to lift the foot off the ground and avoid dragging the toe.
Low-intensity exercises for dorsiflexion include toe raises and side lying. This exercise places the dorsiflexors in a gravity-eliminated position and allows for maximal range of motion for patients with limited muscle strength. Another low-intensity exercise for the dorsiflexors includes seated toe raises. The patient lifts the toe while minimizing movement at the knee. This exercise allows for isolation of the dorsiflexors against gravity. For moderate intensity exercises, the patient can perform toe raises with a TheraBand. This provides an external resistance to the dorsiflexors. The therapist holds the TheraBand to provide resistance as the patient brings his toes towards him. This is a concentric contraction of the dorsiflexors. As the patient lowers the foot into plantar flexion, the dorsiflexors are eccentrically contracting to control the descent. Another moderate intensity exercise for dorsiflexion are heel walks. During this exercise, the patient ambulates on heels while pulling toes upwards to keep them from touching the ground. The dorsiflexors concentrically contract to keep the toes up. This is important for proper gait performance. Patients should focus on concentrically contracting the dorsiflexors while also maintaining balance during the swing phase of gait. Another moderate exercise for dorsiflexors are cone walks. The patient lifts the leg over the cone with hip flexion, knee flexion, and dorsiflexion of the ankle. The patient is then instructed to lower the leg and land with the heel and slowly progress into neutral position. This exercise aids the patient in performing dorsiflexion while also flexing the knee and hip. This exercise has a functional component as it is an integral part of walking.
A high-intensity exercise for the dorsiflexors is mountain climbers. In this exercise, the patient positions themselves on all fours and alternates bringing the legs forward, flexing at the hip and the knee. This exercise forces the patient to go into dorsiflexion to keep the toes from scraping the ground. This is a functional exercise that incorporates many different muscle groups. The patient works on incorporating dorsiflexion in concert with knee and hip flexion. This combination is important for activities such as walking up steep hills or climbing stairs. Another high-intensity exercise for the dorsiflexors are hop jumps, which were previously prescribed for plantar flexors.